nebulizer is attached to a flow of air or oxygen, converts a solution of a drug into an aerosol for therapeutic inhalation. Assessment. Evaluate patient's need for nebulization. Evaluate arterial blood gases, sputum cultures, and chest x-rays. Review the physician's nebulization order for length of treatment and medication to be used. Assess patient's lung sound before and after each treatment. Observe consistency, amount, and color of expectorated sputum. Assess need for additional physiotherapy to improve respiratory function. Assess pulse and respiratory rate to establish baseline data. Objectives: to deliver aerosol medications, to promote a better ventilation ratio by increasing bronchodilation and alveolar ventilation, to prevent or treat atelectasis, to administer mucolytic medication to lower the viscosity of the secretions and aid expectoration, to decrease pulmonary edema, to deliver an antibiotic to a patient with chronic purulent infection, to decrease the work of breathing, to administer bronchodilators for the relief of bronchospasm associated with respiratory disease such as asthma and chronic obstructive pulmonary disease or COPD. Equipments needed: prescribed air supply, adapter, nebulizer apparatus or machine, mouthpiece or appropriate oxygen mask, prescribed medication, and sputum cup. There are 4 special considerations. First, the medication as well as its administration by air or oxygen is prescribed by a medical practitioner. Second, it may need to be diluted with 2 to 3 ml of normal saline and is normally prescribed 3 to 4 times a day. Third, the procedure may be coordinated with chest physiotherapy and may be administered by a nurse or physiotherapist. Fourth, for a patient with asthma, an estimation of peak flow of tidal volume may be recorded before and after nebulizer therapy.
Check medication order against the original physician's order according to agency policy. This comparison helps to identify errors that may have occurred when orders were transcribed. Know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport medications to the patient's bedside carefully and keep the medications inside at all times. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Explain procedure to the patient to gain cooperation and to allay anxiety. Fill the nebulizer cup with the ordered amount of medication. This ensures that the required medication amount is given. Turn on the air compressor. Observe the fine spray from the nebulizer to check the equipment is working. Encourage the patient to breathe the nebulized vapor through the mouthpiece or mask. Breathing through the mouth or normally with a mask helps the medication travel to the lungs for maximum effect. Remain with the patient until all the solution has been nebulized. Instruct the client to continue the treatment until he or she can no longer see a mist on exhalation from the opposite end of the mouthpiece or vent holes in the mask. Lack of mist ensures that the client has inhaled the entire dose. Encourage the patient to expectorate, as the medication may help to loosen the bronchial secretions. Ensure that the patient is left feeling as comfortable as possible. Bronchospasm is further reduced if the patient is relaxed and reassured. Wash and dry the nebulizer, tubing, and mask or mouthpiece with warm, soapy water. Proper cleaning decreases the possibility of pathogens entering the client's respiratory tract. Retain the equipment in polythene bag. For the patient's next administration to prevent infection, the equipment should be changed every 24 hours. Documents the nursing practice appropriately. Monitor adverse effects and report any abnormal findings immediately.